El siguiente ponente es, a ver si lo digo bien, el doctor Reiner Stange, doctor en medicina, especialista en medicina naturista, jefe de médicos del departamento de medicina naturista del lmmanuel-Krankenhaus en Berlín, que nos va a hablar de la formación y perfeccionamiento en la medicina natural en Alemania.
Sí, buenas tardes. Muchas gracias por la posibilidad de hablar con él. Está, creo que en 2018 que estuvo a Barcelona con su conferencia. Este tiempo, permiso, no he mucho tiempo por prepararme en español. Porque yo voy a hablar en inglés, pero espero que las diapositivas son fácil a comprender. Thank you, Santos, for inviting me and giving me this this title, Formación y perfeccionamiento. What is it? So actually, we're always talking about these three parts of our professional formation and our professional practice. I think it's three stages: university, and then especialización, and then after you are specialized, whatever happens for 20, 30, 40 years, no one knows. So we had probably the same discussions as you have. In which stage, which form of studies and introduction to the topics that we have is most suitable? We all want to be on the first stage in the university, right? We want to instruct the young people about naturopathia and other achievements that we think are very important. But as in Spain, I will show you, we have some but very tiny chances to do that. And then comes specialization, which is mostly done in hospitals. Heavy pressure on the people to work a lot and study a lot, and after 4 or 6 years, then they have exam, and then they're specialists. Okay, and then most of them continue in their own practice, and then this is has been the rule in our country. After some years of practice, many questions arise. What happens here? Why are these patients unsatisfied? What can I do with all my knowledge? So many people that visit our congresses come to us after 5 or 6 or 7 years of their own practice. And when they realize that some things, are not in equilibrium between what they learned and studied in university and in the specialization and what happens in the real world, as we say nowadays. So many people say this last stage is very sensible for a person, for a doctor to pick up naturopathia. But is it too late? We don't know. It would be nicer to have it before. So we now start to advertise our classes at a much earlier stage for students in their late stages and for young doctors in their early stages. And we hope to lower the age at which they take these courses. I will show you what it is. We have very strong legislation about professional doctors that is more than 100 years old, and it's always reformed. And we have in the last large reform in 2002, there will be another one very soon. We have this division in 22 especialidades, and 14 what they call cross-sectional topics. And this is imaging and psychosomatics and all kinds of things. And after a lot of discussion, we had this cross-section 12 that came up in 2002. And we were very happy to explicitly, as a word, to have naturopathia in this. This is a law. This is federal law. Every medical student that passes university has to pass these instruction by these laws. So we are very glad that naturopathia is written in there. This was a success, undoubtedly. And it's on the same cross-sectional level as rehabilitation and physical medicine. And in fact, if you go to the United States or another country, you will see that in many countries, parts of physical therapy are there regarded as complementary medicine. This is strange to us, strange to you, but it is that way. So, of course, we have these relationships between physical therapy, physical medicine. So actually, it's not quite wrong that we are in this cross-sectional area 12. So what is the situation now? We have 110,000 medical students in Germany, and so actually we should have a lot of teachers to teach them this naturopathia. But also in this law, it states that the faculties don't necessarily have to offer classes in naturopathia. It is a matter of exams. We have written exams like you probably do with many questions, multiple choice questions, and some are in naturopathia, but only very few. So after these changes in the early 2000s, we slowly rose the academic body that is necessary to teach these many students. And we were lucky to have a lot of private money from foundations, as you have too, to support the medical body by these different levels, senior professors, assistant professors, and PhDs on their way to be professors. So nowadays we have about this situation for the roughly 40 faculties. So not all have a cathedra, not all have a professorship, but there are nowadays some kind of activities almost everywhere in the country, and this is very a very remarkable development in the years that I have been able to observe this. So I'm very lucky about this. We also have some master courses, as you have, but they are for several professions, not only for doctors, but also like for pharmacists or for other health professionals. And the problem is that with this master, like in complementary medicine or in natural medicine, it is not really clear what your professional life will be afterwards, because we have a very strict regulation who is able to treat a patient. This is usually a privilege left to doctors, and they can delegate things to physiotherapists, to dietitians, and all these additional professions that you know. Well, all this is changing at the moment, but at the moment means for 10 or 20 years, you know, it takes very slow, because the medical profession has a lot of privileges here in most countries in the US. they will not delegate these privileges to people that have a master in complementary medicine and have them do the same things. So that's a problem. So what we try to instruct when we have students, mostly it's lectures. We have students in our hospital, and we are lucky in Berlin, we can show them real patients and real treatments. And they can do their part of their practical work that they have to do during their studies. So we can do quite a few things, but it's not that privileged everywhere. So this is what we teach. It's not really defined what we may teach or what we should teach. It depends, to my impression, mostly on what those who are in the position to teach think that is important. We do have, maybe as a difference to Spain, we do have some separation between homeopathy and other complementary integrative medicine. So at this point, there's a very, very heavy discussion at the moment in Germany to more or less end academic homeopathy. And it has been successful because most of our doctor bodies have canceled the additional training for homeopathy in recent years. So we will have fewer trained doctors to practice homeopathy. On the other hand, acupuncture is very popular. There's a very good system of training for doctors to do acupuncture. And maybe some of you have heard that in the early 2000s, there were very large randomized controlled trials, but also observational trials that were sponsored in Germany, financed by the social security system to find out. And it turned out these trials had very, very good publications in very renowned journals. So in the end, we now have reimbursed paid acupuncture for the patients by social security system in 2 indications: lower back pain and osteoarthritis of the knee. Other indications like migraine or headache, tension headache, failed to pass the system. We hoped that some years later, with more evidence, more clinical trials, this would happen, but it didn't happen. The door was opened, I would say, by Social Security to this limited access to acupuncture for 2 indications in 2002, 2003, and it had not been open more. So, but still, a lot of patients profit from this. Now, I will show you the speaker before me had wonderful pictures of the history of naturopathia in Spain. I love that. I love history, and we do have to have a sense of history in our field. So this is where our academic teaching started in 1906 around. And you can see this right downtown in Berlin when you visit us. And here, underneath the roof, there was some space to install a new field, hydrotherapy. And why did this happen? Before they had it in Vienna, and the Berlin academic people were sort of envious about Vienna having a chair, a professorship for hydrotherapy, which they created in 1897. So at that time, Vienna and Berlin were fighting for the top position of academic medicine in Europe. So the people in Berlin said, if they have that in Vienna, we want to have that too. So this happened, this is my theory, why they put up this hydrotherapy. And it was very successful. Whoops, I'm sorry. It was very successful, and here this guy, a brilliant guy, had the first chair for hydrotherapy at Shari. This guy came, and I'm sorry I didn't translate this. This is Klinik für natürliche Heil- und Lebensweise. It's a clinic for natural healing, but also prevention, lifestyle. Lebensweise means lifestyle. At that time, in the 1920s, unbelievable, they were already involved with lifestyle. And you mentioned this history of AEMN, and I remember that I think in 1992, my boss at that time, Malte Bühring, was invited to an AEMN Congress, and I remember very well that he returned and he talked to us and said, they have brilliant colleagues in Spain, and it's wonderful, and we have to cooperate with them. And after that, we had lots of meetings. We tried to establish a European society. It was even established, European Society for Natural Medicine, ASCNM. And we had meetings, a lot of meetings in Spain. I attended some of them. And I know some of you that are sitting now in the Congress from these days. But actually, it's a pity that we were not able to continue this and to enlarge this cooperations, but it still is one of my very, very wishes for the future. So let's talk about the Formación continua, the Weiterbildung, the on-the-job training, as the Americans say. When you're a doctor, you're internal, gynecologist, pediatrician, whatever, then it's necessary to have them training in naturopathy. And we were able to convince my predecessors, of course, were able to convince our national chamber doctors to introduce a title, Tratamiento Naturista. And this was a long time ago, almost 50 years now. And there's a curriculum, there's a set of topics and of requirements you have to fulfill. And it's now at 240 hours, so it's much less than your master's. Jose Luis Berontes, who was a good friend of mine, invited me to his class in Barcelona many years ago. So I had a very good impression of your master classes. They are very good. This training is much below. You can do some training in a hospital like ours, but usually it's not paid for. You have to do it in your vacation or between two jobs or whenever you have some time. So you don't have to do this. You can sit 240 hours in the classroom and pass an exam, and then you have this title, Tratamiento Naturistas. So it used to be obligatory to have a practical part, which I think it is, but many years ago, the Chamber of Doctors skipped this criterion. So, and you don't have to do a paperwork, it's only an exam that is organized by the Chambers of Doctors. So in these days, after 1975, about more than 30,000 German doctors have passed this program and obtained this title. And our very good times were in the 80s and 90s, not in the 2010s, unfortunately not. In those days, we had more people passing these exams and having this title. So as some of them are dead by now, we have about 16,000 German doctors out of roughly 400,000 that have this title, about 4%. So it's not that much, but we're there. This title, Tratamiento Naturista, was an example to create others. Shortly after 75, homeopathy had a similar curriculum and a similar recognition by the federal and the local chambers of doctors. This was very impressive in the 70s. And then we had manual therapy or chiropractic. They use it in the same manner, the two terms, which is not quite correct, but forget. And later, in the 90s, we had acupuncture as an official title by our national and local chambers of doctors. This is very impressive because there used to be a lot of prejudice towards traditional medicines that were not scientifically based and towards medicines from other countries like China, India, whatever. So, but I think the evidence created by a lot of RCTs in acupuncture was so overwhelming that in the 90s, this was accepted. Also, we have a very good scientific society, Ärztegesellschaft für Akupunktur, LGFA, some might know. They're very active, and this proves to me that it makes sense to have very good scientific medical bodies like IMN to promote the topics and to achieve progress, which is not, it doesn't progress, does never come by itself. You have to work and work and work. So, I would like you to read these few lines that I translated by Diepel. I'm sorry. I hope you can understand it. This is the first lines of our curriculum of the national chambers of doctors. So it's all written down. It's very strict, and this is a very good definition that we could work on. But they accepted it, and I think it's good. It's very good, and the program is very good. It could be a little bit more practice. That's my main objection. So maybe you read this for a moment. And of course, we have many definitions of naturopathia, but we have to have, like the Americans say, a working definition. A working definition is something that is not your best that you can think of, but one that makes sense in the real world that everybody can accept. So I think this is quite good, and we're quite happy to have this program. But Santos, who suggested the topic, and I agreed, he added perfeccionamiento, which to me means make it perfect, right? So what can we do? Actually, we should have, I think, I can also speak about Germany, a little bit of Switzerland, where I know conditions a little bit, but maybe you think how it works in your country. We should have more dialogue between phytotherapy, acupuncture, nutrition therapy, whatever. We have a lot of
Dr.
therapies.
Reiner, 5 minutes.
Yes, muchas gracias.
5.
I'm close to the end, yes. So most of you in everyday life will apply several methods. But probably if somebody asks you, what is your main thing? You say, oh, yes, I'm an acupuncturist. Oh, I'm a chiropractic. Oh, I'm a phytotherapist, whatever. So try to have constructive dialogues, and especially what works together. Usually when we use this multi-component or multi-dimensional approach, we are not really aware what is a best mixture. Usually we compose something by our intuition, our experience. So this is hard. I agree, this is hard to test in randomized controlled trials, but it is possible. So on the long run, this is what the real world is. It's not only acupuncture, only neurotherapy, only phytotherapy. Usually for your rheumatological patient, your patient with osteoarthritis, with fibromyalgia, usually apply several components and mostly at the same time, simultaneously. So in the clinical trials, we usually examine one component one after another. That's much easier for the methodologist, but you can't do this kind of study. So this is the future for clinical research. And the last point, and I'm coming to the end, I strongly would encourage cooperation between AMN and, for example, ZEN, Z-A-E-N, that I represent, the national body in Germany. On this last point, we are far from that. At the moment, you can't see a movement in the European Union to harmonize qualifications. But this has been a topic, I know that for sure, this has been a topic for many, many years, but they know that it is very hard. Take surgery or internal medicine or pediatry, whatever, to define a field and say a doctor who was trained in Spain has similar qualifications like a doctor in Denmark, in France, in Italy, in Germany. So this is, but it has to come that way because so many people exchange and work here and there, and that's good, that's perfect. So this will come up to us, and in my opinion, at the moment, from the 27 EU countries, I think Spain, Switzerland, and Germany are furthest ahead and have a history of this training and how to create this curricula and what to expect from a doctor who can say, well, I do naturopathia. So I think when it comes to that, we should stand up and say, here we are, we can advise the European Union, the bodies there, what should be or should happen that way. There has been an Spanish colleagues, Cambrella, that was in 2008 and 9 approximately. The final report can still be downloaded. It's very, very important to read. Cambrella, like an umbrella, and Camp, CM. And this was supported to organize meetings and to state what the situation in the 27 countries is. And the report is very interesting. So from that, you can estimate that as an organized movement like AMN, Spain, as I said, and maybe Austria and Germany are far ahead. Switzerland will not be asked in this moment because it's not part of the European Union. It will probably not be. So actually, we should create a dialogue on these things and visit each other and see how we can, of course, optimize our systems and write them down in English language, which we haven't done so far. And sometimes so that when somebody asks what's happening in that field, we can say, oh, here we are. We have experience on training doctors for 50 years, and we've trained so many thousands, and it works. And so be prepared for that. Besides that, I have very nice personal meetings with colleagues in Spain, and some of you have attended Baden-Baden, the Medical Week, which used to have a translation. They don't have anymore, unfortunately. Some of you were trained in even in German clinics, I know, or in Swiss. So we should continue with this cooperation. Thank you for your attendance, and thank you for letting me in.
Thank you very much for all.